Hello, this is Ben at Fitness Beyond 50, and today I have a trusty client slash friend slash patient slash model that's going to help us with this segment. This segment is on a mini massage for seniors who have shoulder, neck, and lower back issues. And this is how it's done. So, what are some of the benefits of massage, if you will? Increase your circulation, breaks up connective tissue, removes toxins, lowers your blood pressure. So it does an array of things. So if you haven't tried this, you definitely want to try it. Find you a licensed or certified practitioner, one that's been in the field for quite a while. And believe me, if you have never done it, once you do it, you're going to say, why did I take so long to do it? Now, what I'm going to be doing for this client, since they have shoulder, neck, but specifically lower back issues, we're going to pre-treat her with a product that I call Tiger Balm, but also I have it laced with some other products. I do show you this product that I'm using in a segment called an ointment for muscles and aches, so look that up. Now, what this ointment does is one of the only ones that actually truly goes to the muscle group and works to relax that muscle and to help increase circulation. So, of course, we're going to be focusing on the problem areas that she has in order to help give her some relief. Now, this is called pre-treating, what I'm doing right now. So she's being pre-treated. What I'm going to also do is that since her lower back is a big issue, I'm going to be giving her a heat treatment. I also have recommended this particular clay heat treatment because it holds most of the heat. You also see that in a video. Take a look at it and I tell you where you can go to get this. Now, what you're going to do, since it's the lower lumbar region, I'm going to be covering the lower lumbar region with a protective cloth first. Then I will be placing the heating element or the clay heating element on the lower back. I also make sure that the client is covered up, therefore, one, for their privacy, two, it helps contain the heat even more. Now what we're going to do is we're going to actually use a oil that is a coconut oil. You always want to make sure if the client is allergic to anything, and of course you do a complete medical history and you get a medical release before you do any of this, so definitely check with your doctor to see if this is going to be something that you can actually do. Now, if the shoulder has a nerve that's causing the client a problem, we would actually take the arm, put it in the down position to stretch it, and we would do circles and then counterclockwise circles to help try to get that nerve to fall from between that particular joint and muscle. Okay, so that's something that we also would be doing, but for the sake of time, I'm moving this up. So once the client or patient is treated, then you want to start the process. Now, what I'm going to do is some very long movements here, and this is called streaming, getting the blood going, getting these muscles ready. Now the pressure, she's getting what we call a therapeutic, meaning that it's right before a deep tissue massage. So you'll be able to work the knots out, but it won't be to the point where it's discomforting for the client or patient. Okay? Once again, we have the heat treatment working in the working on that lower lumbar region while we're working the upper trap area and the shoulder area. It takes about 3 minutes to relax a muscle group totally. As you can see, nothing is exposed on a client or patient except for what you're working on. And as I said earlier, we're just focusing on the back, neck, and shoulders and arms, so therefore nothing else has to be done. But this is something that will give you a lot of benefits as a senior, because many times our circulation becomes very poor, our range of motion becomes very poor, and a therapist can help stretch you, can help improve your range of motion, help increase your circulation, help to lower your blood pressure, and you get a sense of well-being. The other part of this is touch is so important and vital to overall health. The most important body part on the body and the largest organ on the body is what? The skin, the integumentary system. So just like babies, they love to be touched. We're adults, we love to be touched. When we don't get touched, we act out. Believe me. And they say that, when people have a companion, they live longer, right? Everybody needs someone. Now, when you're having this done, you can tell the practitioner if the pressure is too hard or if it's too soft. If the practitioner touches, say, on your arm or your neck and pain shoots down your back or to your hands, you want to tell the practitioner that. That's called referral pain, and they'll need to deal with that. If they find any lumps or bumps that they don't know about, they will be referring you to your family physician. So as you can see, I'm focusing on the neck area and this upper trap area. I can feel under my hand as the muscles start to relax. When you go to a reputable place, seniors, they're going to have you fill out a complete medical history. They're going to have you fill out a waiver and release form. And I actually have a checklist for people who are getting this done full body. We actually have a checklist of any area that you do not want someone to work on. Also, the room is very dark with just candlelight or fake candles, if you will. And I always tell all my clients, this is your time to let someone take care of you. So many times, you've worked for 30-something years, you're retired, and or you're taking care of grandkids, or you're just burning the candle at both ends. You need some time to yourself. And what better way to do it than to go have you a relaxation or a massage session? Now you can't see it, but of course I am timing the heat treatment to make sure that I don't leave the heat treatment on too long. I just think it's funny that what you see in the movies is definitely not what we do. The movies definitely takes working on someone to a whole different level there, seniors. When you're looking to relax, you're looking to get all those therapeutic benefits, this is something that you just can't beat. And if you've never had it done, by all means, go get it done. Now, just remember there's different types of massage or relaxation. There's Swedish massage. That's the one that you're going to get like when you're on a cruise or you're going to some type of spa like I own, and you're getting fluff done. That's what I call them. They're just barely touching you, okay? That's just for just relaxation only. If you want knots taken out, you need a therapeutic massage, okay? A deep tissue massage, sports massage, there's Rothling, there's shiatsu. So do some research and find out what modality works best for you. A good relaxation therapist or massage therapist, they're going to pay attention or focus more on where your problem is or the affected area. I'm beginning to think my client / friend / model is not alive. Can you move your hand a little bit? Let them know that you're alive. So what I'm going to do now, I'm going to be moving the heat treatment now. I'm going to check it, make sure that it's still good. I'm going to move that heat treatment to her neck and shoulders now so that I can focus now from the medium part from the midline of her back down to her medius or lower lumbar region, which has been giving her a lot of trouble. A lot of people ask me, of course, in the beginning, if you never had this done, Am I naked? Am I half dressed? Am I in my undergarments? I always tell people you want to get undressed to your comfort level. Okay? You can be in a bathing suit. You can be in shorts and a t-shirt. You can be in your underwear and your bra, or you can be fully clothed. This is, you want to be comfortable when you're having any type of procedure done. Of course, the more comfortable you become with your practitioner, the more that you can, let your guards down a little bit. Because definitely check the place out, because there's a lot of places out there that seek to do other things. But the bottom line, seniors, this is something that you really want to utilize. I mean, just increasing the circulation, the sense of well-being, removing toxins, lowering your blood pressure, breaking up connective tissue. A good therapist, they're going to ask you, hey, are you warm enough? Are you cold? Is this pressure good enough, or is it not? So just remember, it's your time. Speak up. After a relaxation session, the therapist is going to tell you you never want to get up fast after a relaxation session, because if you do, you could get lightheaded or dizzy and you could faint. It's not uncommon to go to the bathroom right after a good massage, because we're pushing those toxins through your body. We also ask you to drink 1 to 2 bottles of water right after, but to just drink water, because that helps flush those impurities out of your body that we're pushing through. If you do not drink the water, you can end up being very sick or feeling very sick for a couple days, and that's because you have not really helped flush those toxins out of your body. And like I said, just for this video purpose, I have moved everything up a lot faster. The average session is 60 minutes. And I do a lot of 90-minute sessions, deep tissue massage. I don't do a lot of the fluff, so to speak. I know this isn't the best angle, but I wanted to make sure that you could see what we're doing here and to understand that the massage or relaxation sessions are very therapeutic. They are very useful. Definitely leave your comments below, and definitely give us a thumbs up. Shouldn't this be you right here getting this massage? Yeah. It's your time to let someone take care of you, to just breathe and relax and enjoy your relaxation journey. I'm going to remove the heating treatment now so that I can go down her entire back all the way to the top of her medius area. Working the shoulders, the upper trap area. I'm going to move from there to her neck area, because we're getting ready to wind this up here shortly. Just remember, after any session, you want to what? You want to get up slowly, sit on the side of the table, let your legs dangle over. Never want to get up too fast, because you could get, once again, lightheaded or dizzy or even faint. We don't want that to happen. A lot of people like their scalp done, but that's what we use a checklist for. Some people don't like their scalp touched, some people don't like their face touched, some people don't like their feet touched. And all of that is taken care of during the intake. So your medical history, your waiver and release, your do's and don'ts. do yourself a favor and go get yourself a therapeutic massage. You deserve that, seniors. You've worked all your life. Now it's time to it's not time to entertain yourself. It's time to spoil yourself. Seniors, are you relaxed? Because of course there's some very nice music in the background and it's normally quite dark. And you can just let yourself go. Just enjoy your massage or your relaxation session. So what are we going to do, seniors? We're going to take care of ourselves. We're going to find things that we can do that's going to give us a better quality of life. I want to thank everyone for watching this video and thank the model for being willing to come in and let me do this, but of course I think she benefits from it a lot better than we do, right? So seniors, what are we going to do? We're going to get up, we're going to get off the couch, we're going to keep moving, and this has been Fitness Beyond 50, saying enjoy some relaxation, go get it, and have a blessed day.